So we'll still be letting people in, but we're going to go ahead and get started. So welcome to the 3 Little Known Secrets About Sleep webinar. Can everyone hear me okay and see me? If you can just, okay, I see Doris nodding her head, so awesome. Thank you so much. For you guys that don't know me, I'm Dr. Faustine Din, and I'm a board certified internal medicine doctor that practiced primary care for 4 years in Braselton, Georgia at the Braselton Clinic. So you guys may have come across the Braselton Clinic or heard about me as a primary care doctor if you floated around that system. And I am also a functional medicine practitioner. And my background is here. My background is that I came out of residency about 5 years ago, just super eager to start seeing patients and treating their day-to-day issues and keeping them well. That's why I went into primary care. And that was my passion, to focus on health and wellness. And what I found was that early on in my practice, I found that there weren't too many tools in order to treat these chronic diseases that come up for patients. We're really great in the healthcare model as it is right now, or at least the mainstream model of treating acute illnesses like pneumonia or appendicitis, and knowing, when to start IV antibiotics or start, seeing, advising for surgery for appendicitis or whatnot. But for those chronic diseases where there's diseases like autoimmune disease or IBS, that sort of thing, it was really hard to find a really reliable model to keep these patients well and to avoid those issues from coming up. So that's how I found functional medicine and began applying it to my patients. And I really found that it helped a lot of my patients ward off, these lifelong medications, like being on a thyroid medicine when they had an autoimmune disease that was affecting their thyroid. So how do we prevent that from happening, or how do we detect it early? And also, we also were able to prevent, life-changing surgeries like having their gallbladder removed. It really makes a difference in someone's digestive health and that sort of thing. So I started using functional medicine for my patients in practice. And then I found an even deeper passion for functional medicine when I started to have some issues come up myself about 6 months after I delivered my son and dealt with severe insomnia and also pain in my muscles and my joints. And what I discovered was that I had this kind of stealth fungal overgrowth in my GI tract. And so I have dealt with what these imbalances within our GI tract can do to our day-to-day function. And we call it functional medicine because it is still a state where we're able to function. We're still able to go to work and wake up and look normal, but inside we just don't feel right. And so for me, it was, very related to what we're going to talk about today with sleep and also fungal issues and digestive issues and that sort of thing. So I thought it would be a good topic to kick off this webinar series with, talking about these little known secrets about sleep and taking a functional medicine approach for it. So I hope you guys enjoy the webinar. And throughout the webinar, if you have any questions, definitely feel free to put it in the chat. I'll have my assistant, Lynn, who may be direct messaging you, asking you for your, your name if it doesn't look clear on the Zoom, just so that some of the medical assistants on here can get credit for attending. But also, she'll be collecting some of the questions if they're kind of scattered throughout, so we can answer them at the end, if you can do that, Lynn. All right. So I want to just put out a disclaimer there that everything that I talk about on this webinar is for educational purposes only, and that, even though I'll be suggesting some things that could help, definitely do your own research. this doesn't mean that we're having a doctor to patient relationship where it's like, hey, Dr. Din told me to do this. I mean, yes, it could be helpful, but definitely do your own research, and also talk to your, medical team and your practitioners to make sure that it is appropriate for your individualized situation. The overview of what we'll be talking about. So, in case some of you guys have to leave early, but are interested in some of the topics that we're talking about at the end, or have interest in this root cause lab consult that I'm doing for my patients, and for you guys in the webinar this next week, this is the overview of what we're doing tonight. So we'll be talking about just general sleep 101. The problem that we're faced with sleep aids currently in the current medical model, and what's offered whenever you go to your doctor and say, hey, I can't sleep. And also we'll go into a deep dive of the 3 functional medicine root causes that contribute to sleep issues. We'll also then go into talk about actionable tools that you can start using now to help with insomnia. And then I will be talking about a root cause lab consult promotion that we're offering for those of you that have access to this webinar and know about it. And then we'll end with a Q&A. So why do we need sleep? For the longest time, scientifically, we didn't really know why we needed sleep. We knew that it was important and that if we didn't sleep, it was a big problem. But we didn't know, what were these, functions that were happening during sleep and what was happening. And so through dementia research and research centered around, trying to maintain and trying to renew and grow new brain cells through something called BDNF, and there's a fancy, medical scientific term, brain-derived neurotrophic factor, which is basically where you grow new brain cells and you keep what you have, and then you kind of dump away what's not serving you. Through that, we have learned that sleep is extremely important. It's our waste clearance system, all of that buildup and acid that's built up in our brain throughout the day is removed through our glymphatic system, which is the system that, has that little river flow into our brain and is able to recycle and to remove waste. All of that is mostly happening at night. So you really need to sleep. And sleep is a very common issue that we deal with in the primary care setting, as you know. Just an overall, the stages of sleep, just for completeness sake, we have 2 main stages of sleep, non-REM sleep and REM sleep. And normally what's supposed to happen is we're supposed to go through each stage in the right order, and we go through several cycles of these stages during the night. And so in general, non-REM sleep is that deep sleep, starting from beginning lightest to deep sleep, and then the REM sleep is where dreaming happens. And, a lot of people just stay in some of these stages all night, where they only go into 2 stages, like N1 is the lightest and then REM is the deepest. They may only go into N1 and maybe N2, and then they wake up. And so they're not really getting that restful sleep. So our goal is to have optimally 7 to 8 hours of sleep a night, and to go through these cycles for best functioning of our brain. Overall, what regulates sleep? Why do we feel sleepy and why do we stay asleep? The general concept is that there's 2 things that are involved, and that's our sleep drive, which is how motivated are we to go to sleep? And then the other thing is our circadian rhythm. So for sleep drive, that is most obvious when you wake up and you're like, hey, I'm not sleepy at all. So you have very low sleep drive. That's what happens in the morning. And as the day progresses, you get more tired. And that is when your sleep drive is the highest. And when we sleep, we recharge that. And then we go through that every day. The circadian rhythm is our clock of how our day is broken up into. And so this is the part of the sleep cycle or the part of the component of sleep that gets changed when we have stretched out days or when we work at night, and we're, working in the hospital at night, for example. And everyone has a little bit of a different circadian rhythm than others. And so, there's some people that feel like their best circadian rhythm for sleep is between midnight and 7 a.m. Someone else might feel like it's best at 9 p.m. and 5 a.m. So just know that there can be some variation in there. So what's the problem with the way that we deal with sleep issues in a traditional model? What ends up happening is you tell your provider that you're dealing with sleep issues, and usually after a few questions, a sleep medication is recommended. And the most common class of these sleep medicines are hypnotics and medications like Ambien and Lunesta. And what happens is that a lot of these sleeping pills can have long-term side effects, but there was actually a PubMed study that showed that correctly prescribed and correctly taken hypnotic pills, and in that study that was just 18 pills a year, was correlated with a 3-fold increased risk in mortality and death. And that is when it was prescribed correctly, which, everyone's interpretation of that is a little bit different, and there's different recommendations. But in that study, it was 18 pills a year. Normally, what ends up happening is people are prescribed a sleep medicine every night. So it's like 18 pills a month. So imagine what that can contribute to, or be at least correlated with. And, with sleeping pills, you can have increased tolerance over time, and the effect of the pill can last, long until the next day, and you can feel sleepy and lethargic. And with Ambien, there's a black box warning that it can cause sleepwalking and that sort of thing. And so I'm not saying that there isn't, risk benefit, analysis. Like there's always, you need to consider that, if you haven't slept in a week, we got to get you to sleep. And so sometimes medications can help. But if we can avoid these medications through fixing what's causing the sleep issue, that would be ideal. And so I put this slide on here that these are what insomnia is defined as. Do you have difficulty falling asleep, or do you have difficulty staying asleep? And within any of these descriptions, it takes me, let's say the first bullet is, or the third bullet is, takes me over an hour to fall asleep. Well, you have insomnia. That's what normally is diagnosed for the patient. Or if you say, I always, I don't have problems falling asleep, but I always wake up at 1 o'clock in the morning and I'm up for at least an hour before I can fall back asleep. Well, you have insomnia. And so these diagnoses don't really help us figure out what's causing the insomnia. And so my hope with this lecture is that we can go into what the functional causes for insomnia are and how we go about treating it. So this is a schematic that I made touching on the reasons for not sleeping. And it kind of breaks it down from things that we do throughout the day that can affect sleep, or systems that are out of balance that start revealing its little head throughout the day or throughout the night. That can be a sign of a functional system imbalance. So we'll start from the left, where a lot of us are consuming caffeinated beverages and caffeine containing food items and that sort of thing. And so the obvious culprit is if you are consuming a lot of caffeine, then you may have trouble sleeping, especially if you have the genetics where you're a slow metabolizer of that caffeine and it kind of stays in your system for longer. And so that can definitely cause sleep issues. But also having computer and blue light stimulus a lot during the day can make it difficult to sleep as well. Having a lack of exercise can also cause sleep issues because of its having exercise actually helps with balancing out the awake hormone and the sleepy hormone, especially if you exercise in the morning before, preferably before 1 or 2 p.m. And so I put on there that, you actually want exercise, and we prefer that exercise be more of that higher intensity, so that you can really, work off that cortisol that's secreted in the morning. And we'll go into cortisol a little bit more in the webinar. I put on there K plus and Mg, which are the elemental symbols for potassium and magnesium, because throughout the day, if we're not consuming foods that have good potassium or magnesium sources, then that can cause a lot of sleep issues at night. And I see that a lot in my patients that have insomnia, and then they also complain of having muscle cramps or restless leg. A lot of times that is due to having a potassium or magnesium deficiency, because magnesium and potassium are calming sort of elements, and they calm our system. And so that's something to definitely consider throughout the day, to consume plenty of. And that's through green leafy vegetables, nuts, and sometimes patients, can be on like a healthy electrolyte supplement that can help as well. With sleep hygiene, having, again, that blue light stimulus and TV and light right before you sleep doesn't help. And it will keep you awake, and it suppresses melatonin secretion from your brain. But also something that could help is that slow breathing, which is what I recommend for people, is breathing in through their nose for 4 seconds and then out through their mouth for 6 seconds. And that really helps to get the body signaled, hey, it's time to rest, it's time to relax. And so that can really help with sleep. So those are just some things that I wanted to touch on for actionables, and we'll go over some more of those actionables again at the end of the webinar. I have here starred 3 bolded topics in general. The first one is liver health and adrenal health. So we'll go into that at the second part of the big topic in the lecture. But I actually forgot to mention one other thing. I put in there carbs around that mid-morning time in bold too. So eating a very high carbohydrate diet, especially in the morning. So carbs are things that are starchy, or basically they break down to sugar. Eating a high carb diet in the morning can make you want to crave carbohydrates in the afternoon, and that can cause a lot of fluctuations in your blood sugar, and that can cause a lot of sleep issues too. So that's actually what we'll be talking about next: carbs and blood sugar and how it affects sleep. So there's a concept called insulin resistance, where when you eat a high carbohydrate diet, it can lead to insulin resistance, and then after that have diabetes or pre-diabetes first, and then diabetes. So just going over some basics about blood sugar regulation. Whenever we eat carbohydrates, there's a lot of sugar molecules floating around here. So we eat it, our gut digests it, breaks it down to sugar, glucose. And that floats around on the outside of our cells. And we have billions and billions of cells. And our cells don't really like a lot of sugar around. It sees it as a little bit of like an inflammatory kind of toxic thing. So it wants to shove it into the cells so it doesn't damage the outside of it. And so the thing that helps to shove it into the cells is a hormone called insulin, and that's made in your pancreas. And so what happens is, if someone eats a diet that has high carbohydrates all the time, that can really train the body to always want to make a lot of this hormone, to push a lot of this glucose in. And so this hormone gets less sensitive. And that's why we call it insulin resistance, because it's not sensitive anymore. We need a lot of it to push the glucose in. And so this blood sugar roller coaster that we expose our body to can cause a lot of highs and lows and highs again throughout the day. And this is a picture conveying that. So this turquoise line is where we want our blood sugars to fluctuate. We eat a little bit of carbs and protein, and then it goes up a little bit, and then it comes back nicely, and it's in this nice like shallow graph here. But when we have this roller coaster by eating sugary foods, it spikes up our blood sugar, the insulin is oversecreted, and it shoves into the cells. And what happens is your blood sugar not only goes down, but it actually drops, and it doesn't feel good. This causes a lot of, depression-like feeling, tiredness, and then you just feel like you need something to wake you up, because this is probably around like 9 or 10 o'clock in the morning, you still got to work. And so you go for something else to make you feel good. And that is normally another carbohydrate heavy drink, like, a Starbucks coffee or a Frappuccino or something like that, or a snack that brings that sugar back up. And if it's not a snack that is high in protein, it's going to spike it back up again. So how this relates to sleep is that these low blood sugar events can make it hard to sleep, but also the high blood sugar events can make it feel like your body's in a little bit of a stress state and you're wired. We all know that sugar high feeling. So it's a little bit more of an obvious source of insomnia, but I also wanted to talk about it because over time it can cause liver issues and fatty liver and that sort of thing. So insulin resistance is what we're overall talking about. Like I said, over time, the pancreas, it's trained to secrete that high amount of insulin to get the sugar in. And that causes, issues with energy, can cause problems with sleep, and eventually affect the liver and adrenal health. I wanted to show this advanced sugar panel that I order for my patients in the clinic. And a lot of these are not drawn in your routine physical labs with your doctor, or even if you have diabetes, it's not usually ordered. But what I wanted to stress here was that this is a test to detect for insulin resistance very early on. And this has been shown in studies to show up even as long as 10 years before someone's diagnosed with diabetes. So what happens is, usually the two numbers that are collected are the hemoglobin A1C and the glucose. And these are usually, if you're not diabetic, they're not abnormal. So we're told, hey, you don't have diabetes, everything looks good. But what happens is when we check insulin and C-peptide and adiponectin, it actually shows that the reason why your sugar looks this good is because it's having to chug out this much insulin. And the normal range is less than 10, but actually in functional medicine, we recommend less than 5. And so that's like almost 3 times where it should be optimally. So this can be, kind of misleading. So it's really helpful to check for that insulin. And that's what we do for my patients in order to really get ahead of things, in order to not cause issues like liver problems, because liver issues kind of just come up in like normal medicine. It's like all of a sudden you have liver problems. It's like, why? This can be a big culprit of it, unless you have an obvious, issue with liver toxins and alcohol and that sort of thing. But a lot of times fatty liver is a huge problem in our society nowadays. Okay, so liver health. So our liver, it's our main detoxification organ, and it is doing a lot of things for us. It does a lot. So it requires a lot of energy to perform its functions, and it requires a lot of nutrients and things to make it healthy. So the liver is in charge of storing our blood sugar in the form of glycogen, so that we have this constant storage of it in case we're in a fasting state, in case we know we haven't eaten for 10 hours or 8 hours. There's a reason why we haven't, fallen down and gone into a coma from low blood sugar and hypoglycemia. And it's because of the glycogen that's been broken down in our liver to keep us awake. And so over time, if the liver has, insults to it, like toxins, like having erratic blood sugar levels, or it is fatty, and that's usually due to a high fructose glucose diet. A lot of people think a fatty liver is due to high fats, but it's not. It's due to having this hyper insulin state, and then your liver doesn't know what to do with it, so it just kind of deposits it as fat. And so in functional medicine, when we think about liver health, some of the signs of liver struggle is feeling tired all the time, feeling sluggish, having indigestion, because underneath this liver right here, there's a gallbladder that helps with digestion, and feeling nauseous after a meal, or waking up in the middle of the night. So that's why I wanted to talk about the liver health, because that can be a cause for insomnia too. And so let's kind of touch on that a little bit. And how does the liver cause insomnia? Yes, I can understand okay, it can cause fatigue, but what about insomnia? How does that relate? So what happens is when you're sleeping, and let's say your sleep time is 9 o'clock in the morning, what it's doing is it's relying on the last meal that you ate for the blood sugar. It's relying on the blood sugar from the last meal that you ate. But as the night goes on, after a couple hours, that blood sugar starts drifting down, and the body needs some more, at least a little bit of a low level sugar around in order to function. And, there's this magical, process that happens with the liver and our adrenal gland in order to make that sugar come out of the liver. But what happens is when you have a stressed out liver and it's not healthy, that glucose reserve doesn't come out of the liver. And so what ends up happening is there's a gland called the adrenal glands, which is further down, that wakes you up in the night to literally say, hey, we're in danger here because there's not enough sugar around. The liver is not giving me what I need. So the body's going to wake you up. And this usually happens between 1 to 3 a.m. because that is the time when the liver is most active and it's doing its most work. So the liver may have given you that little squirt of glucose throughout the night, but between 1 and 3 a.m., it's like, sorry, I'm tapped out because I'm dealing with all these other toxins and trying to make hormones for this person. I'm trying to make cholesterol, and I'm just too busy. So I'm not going to be able to give you any glucose. So a lot of people wake up between this 1 and 3 a.m. and it's kind of like, why is this happening every night? And it might be a liver issue. And so there is some tests that we can do to look into the liver health as well. And a lot of people, when they wake up, they think it's a bladder problem, but a lot of times if they sleep through the night, they're like, it's not a bladder issue. The bladder issue goes away. And so I found that really fascinating, especially with that consistency of that 1 to 3 a.m. So that's you out there in the audience, really consider that it could be liver issues, and that most of the time it's not detected on normal blood work, but through an overall assessment of the issues that you're dealing with, that we know that this is happening. So how do we support blood sugar balancing? We work on sleep. I know that blood sugar issues can cause sleep issues, but if you're not sleeping and you're choosing not to sleep, at consistent times, or, you're up all night and you feel like, I'll sleep later, having a lack of sleep or a disruption in your sleep, even for a night, can really make your insulin and glucose get out of balance. So definitely work on sleep. We want to strive for a healthy eating plan. Like some of the diets that I recommend for my patients that have blood sugar balancing issues is, a diet that is low in glycemic index, or a ketogenic diet, a healthy ketogenic diet, or a diet that has a good amount of protein with every meal, that sort of thing. Timing of your meals is also really important. So we know that if you eat your carbs, if you're going to eat carbs and you're going to eat a carb heavier meal, it's probably better to do it in the morning than at night because of that, roller coaster of that blood sugar. So you'd rather, get that out of the way in the morning if you have to have a high carb meal, because we know that insulin is more sensitive in the morning as well. And then you also want to focus on hormone support, like getting your thyroid hormone healthy and your sex and adrenal gland hormones healthy. We want to work on exercise or rest if you're over exercising or you're over training, because that can get rid of the blood sugar, efficiently with moving your muscles and that sort of thing. And then with herbs and supplements, there has been supplements that have been shown in research to be helpful for diabetics and people with insulin resistance and that sort of thing. And that would be spices and herbs like cinnamon, ginger, and berberine. And so we recommend those supplements a lot for our patients that deal with sugar issues. Okay, and so we went over liver health a little bit. Now we're going to go into adrenal health. And with adrenal health, it can definitely impact sleep as well. We talked a little bit about that cortisol release, but it also can make people feel, that tired all day and that wired at night feeling. They're just sluggish all day. They've been trying to have, do a lot of pick-me-ups throughout the day. And then at night they can't sleep. So we see those types of patients a lot. And so I'll go into what could be causing that as well. So the adrenal glands, we have two of them. Most people have two of them. If they have two kidneys, they usually have two adrenal glands. They sit right on top of the kidneys here. And they make our hormones, they make many different hormones. They make our sex hormones, our cortisol, and then several other neurotransmitters. And they make cortisol that regulates our metabolism. It helps control our blood sugar balance, and it's our wake up and go hormone. It's usually released during times of stress. And by release, I mean kind of over-released. It's not a bad hormone to have. We need it in order to have a normal blood pressure. We need it in order to wake up and feel alert. But the problem that I see a lot in my patients is this hypercortisol state. And these patients might have high blood pressure, or they might have that wired or very anxious feeling. On the opposite hand, I also see a lot of people who have very low cortisol, and usually it's due to having a cortisol state that they're kind of burnt out. And so we'll go over examples and also objective testing on how I look at cortisol levels, so you can see this contrast of patient presentation. These are some of the main contributors of adrenal stress. And you can have one of these stressors and have adrenal problems, or you can have multiple of these. So just know that, you don't need to have a huge insult from, multiple causes. It can be, just too much blood sugar control issues, and that can cause adrenal issues. So in general, when we call adrenal issues, adrenal stress, adrenal burnout, they're kind of all used interchangeably as we go forward. So I wanted to show this depiction of 4 different types of women that have adrenal burnout. Not that men can't have adrenal burnout too, but a lot of times, I see a lot of women in my practice. And so, 4 different types of women. So we have wired for speed, wired and tired 1, wired and tired 2, and then just plain tired. So that wired for speed is that woman that is, the president of the PTA. She has like a super ambitious job. She is, always go. She's superwoman. And she's like, I'm sleep when I'm dead. And so, usually these patients, they they look really good, and sometimes they thrive on this high energy state. But I find that it only lasts for so long. And a lot of times they go into this, they progress into these different stages as a result of that, if they don't really work on trying to decrease their stress or work on their sleep. And a lot of times they rely on a lot of high sugar foods to kind of keep themselves in that state too. And so the next stage is wired and tired 1. That is where the person has very high cortisol. Again, we mentioned that get up and go high energy hormone, but they are starting to show signs of adrenal burnout. So they start having low neurotransmitters. So the neurotransmitters are also, this, it's also this part of the adrenal gland that makes it. So if you're making a whole lot of cortisol, something's got to give. So one of these things start drifting down, even our estrogen starts drifting down. So it's hard to do things like, rest and digest and, keep and make a child, and people getting pregnant too when they're in this state. And so as the person continues to be in the state, what I find is they progress more and more to the next stages. And as you move more towards the right, it gets harder to get back to health. And it takes, this person, the superwoman, can get better in a matter of a month or 2. But if you're here and everything is low and you're in this extreme case of adrenal burnout, it can take 6 months to a year to get better as far as getting your adrenals back to balance. And so we support these patients by, lifestyle changes, by getting them to have adrenal function that's more optimized by putting them on certain supplements, or even giving adrenal gland, desiccated adrenal gland sometimes. So there's a lot we can do to help these people. So this is a test called the Dutch test, and I wanted to show you 2 different patients here. The first patient, before we go into that, this graph is basically the time that you wake up. We check cortisol levels, and we check it 3 more times in the day. And as the day goes on, what we expect to see is somewhere within these 2 black lines. We expect to see it low in the morning, start going up, and then drift down and stay down in the night. But the red lines are these 2 patient presentations. The first patient here is so low. She's lower than the lower limit of normal here. But what you can see here is that this first dot is her morning cortisol. Morning is actually a reflection of what's going on at night. What's happening in the morning is usually right here at this timeline. So right here, it's actually higher, and then it drifts down, it stays down. And then at night, it's supposed to keep going down, but it actually bumps up. So this person is that tired all day, and at night, they might not be able to sleep. They just have trouble. They're an insomniac and have issues sleeping. This person is slightly different. This is our patient that is, off the chart, has very high cortisol levels, and this is that superwoman patient. And at night, as the day goes on, they're supposed to go down. Okay, it's looking all right, but then they shoot up at night. And so this is our wired, very anxious, very frazzled patient that can't sleep at night. So just to give you some examples of that. So the first patient, what I would do for them is I would give them some actual adrenal gland extract for, a short period of time, some adrenal adaptogens, and consider working on their blood sugar regulation and their blood sugar levels, because usually that's what usually causes this. But also they might be missing some micronutrients that are needed for the pituitary gland and for the adrenal gland. It's all this kind of communication pathway going on. So, the nutrition and also the blood sugar regulation is super important. For the second patient, what I would do for them is to give them some calming supplements like pharma-GABA and L-theanine, to be able to make them relax a little bit, and also to really get at what is causing this high cortisol state, like what's going on in their life that's making them so anxious. And a lot of times we can't help, things that are happening around us, but, talking about the stressors that are going on, really targeting those can help. But I know some things are just, it's just the way it is. But in the meantime, we can get these patients feeling better by at least, hacking their body a little bit. So I wanted to touch on menopause a little bit. We're not going to go into it too much in this series, in this webinar, but overall menopause is where your ovary glands are making less estrogen, and you start having symptoms of, vaginal dryness, hot flashes, insomnia. And how this is related to sleep is, like I showed you in that adrenal gland picture, estrogen is also made in the adrenal glands. And so if you don't have a healthy adrenal gland, you are making less estrogen compared to what you're supposed to be making. And, when you're in menopause or you're approaching menopause, that can have a higher demand on the adrenal glands to make more estrogen for you. And that can cause cortisol levels to be very erratic. So that can make you feel like you can't sleep, or that you're having anxiety or mood issues as well. So we definitely want to support the adrenal glands when a person is in menopause too. And I've seen it where someone can have irregular periods in their late 30s or even mid 30s. And they think that, man, maybe I'm going through menopause. But actually, through testing and through looking at their adrenal health, we see, hey, there's a lot of work to be done here. And when we work on this, a lot of times their cycles start to get more regulated, and we're able to postpone that diagnosis of menopause. So that's always nice when you can kind of be healthier hormonally, instead of being in menopause at 30 and saying like, this is just what happened. So overall, for adrenal care support, we work on sleep. We try to repair the circadian rhythm, and we focus on having a healthy eating plan. Again, blood sugar balancing, making sure that we have the backbone for cholesterol production and hormone production, which is cholesterol. Like, all of our hormones need cholesterol in order to be made. And so, it's less common now, but a low fat diet or a low cholesterol diet is not always the best for everyone, because it actually can really impact your hormones. We recommend, exercising or resting. A lot of times I find that it's usually one extreme or the other. People are over exercising and they're not doing anything. So somewhere in the middle really helps regulate things. Stress management. We want to fix cortisol if it's high. We want to bring it up if it's, low. And then these are the herbs and supplements that have some utility in supporting the adrenal glands, especially our B vitamins and vitamin B6, especially because it has a lot to do with turning on and off signaling to make hormones. Licorice has also been shown to be very helpful for people who have very low cortisol states. You want to be careful with it though, because it can impact blood pressure, So, these are just general ideas that we do for our patients. GABA, which is a calming hormone we use. Ginseng, ashwagandha are adaptogens, so they help to balance the adrenal glands. They don't, cause a super high or super low, like compared to licorice, but they help to balance them. And then actual adrenal desiccated gland we use as well for those patients that have extreme burnout. And then the last thing that we'll go into is digestive issues and gut health, and how that has to do with licorice. Sorry, I just saw your question. Licorice can raise blood pressure, so we want to be careful with that. And so we'll go into digestive health next. So it's cool that the last two topics that I talked about on adrenal health or blood sugar regulation, I find that it's more of like disruptors of sleep. It kind of keeps us up. But looking at the core foundation of the hormone that makes us sleepy, which is melatonin, the gut is what's responsible for that primary effect, making melatonin for us. So I love talking about gut health and how, there's so much that we can do to help with it. So in general, with gut health, we call it the digestive capacity. How well are you digesting your food? And digestion starts in the mouth, and it's a downward process. And it's a mechanical, chemical process. So many hormones are involved, and it needs to function right in order for us to feel normal. And so let's see here. The gut microbiome is definitely involved to make our neurotransmitters and to make the hormones to make us sleepy. And it also can contribute to a lot of digestive issues too. So if you have a gut that isn't healthy and it has a lot of, we have good guys and bad guys, and they all live within us. They're separate from us for the most part within our GI tract, but a lot of times we can get some spilling over and issues there if we don't have a healthy digestive tract. So having a balance of good guys and bad guys is very important to have normal digestive function and to not have things that are taking up all of our nutrients and that sort of thing. So we'll talk about SIBO a little bit and SIFO, which SIBO stands for small intestinal bacterial overgrowth, and SIFO is small intestinal fungal overgrowth. And the presence of a healthy microbiome can impact everything from our mood, our immune system, our brain health, and our metabolism. So we have a lot of different gut bacteria that can communicate with the cells in our body, and they actually make neurotransmitters themselves. And so, they're separate from our production of melatonin. So it's really interesting. There was a study that was done from the American Psychological Association that showed that 80% of our supply of serotonin lives within the gut. And research done at Caltech shows that there's bacteria that actually produce neurotransmitters. And neurotransmitters, for those that don't know, are the hormones that make us feel calm or excited or sleepy, just to name 3 different types of hormones. But, we need to have them in order to function. So melatonin synthesis that we do actually needs a lot of building blocks in order to get all the way to melatonin. So, the first building block that it comes from is tryptophan, which is an amino acid. Amino acid is what's broken down from protein. That is an essential amino acid. So it has to come from the diet. We don't make it ourselves. And it needs these cofactors like folate, vitamin B6, zinc, magnesium, B12 in order to progress through these pathways to make melatonin for us. And so, when we look at the production of melatonin, yes, eat all these foods, but if you don't have a healthy microbiome, you're lacking anyway in neurotransmitters. But also, if your microbiome is really out of balance, you might not be able to even absorb any of these things that you're putting in. And so that's why health, starts in the gut, and it is so essential in order for us to feel like a thriving person. And how it can impact sleep is, on this first degree here, not making enough melatonin, but also having a bad, unhealthy microbiome can make us bloat, make us uncomfortable. And that physical symptom can make it hard to sleep too. And so there's a lot of ways that our gut health can affect sleep. I wanted to talk about SIFO, or more specifically, candidal overgrowth. That's what I actually personally dealt with. And there's testing that we can do to look for candidal overgrowth through a stool test, but also through an organic acids test. So I wanted to bring this up because this is also a form of dysbiosis, because we're supposed to have some candida in our gut, But when we have not enough good bacteria, the candida can overtake the system. And so I wanted to talk about that and how it can cause a lot of different symptoms, including sleep, but just check out all these symptoms. You can have skin, nail, fungal issues, like kind of toenail fungus, nail fungus that just won't go away. That could be a sign of candidal overgrowth. Feeling tired, worn down all the time, fibromyalgia, because the candida, it secretes a byproduct that makes people have pain in their muscles and stuff. Vaginal, rectal itching, especially if you eat something sweet after a sweet meal or dessert. A lot of my patients complain about, some vaginal itching, rectal itching. That is a huge sign that there could be candidal overgrowth. Having frequent UTIs, so, just having 3 or more UTIs a year, always treated with antibiotics, and sometimes it helps, and then, just keeps coming back. And then also having a strong sugar or carbohydrate craving, especially at night, because the candida and the yeast is more active at night, and it, needs more resources to, to have a party at night. So they make you kind of crave sugar, that sort of thing. So this GI map test is a stool test that has picked up candida here. And this is an organics acid test, which there are markers here. Marker 7, arabinose, is the most specific marker for candida overgrowth, because we don't make arabinose as a byproduct chemical, but it shows up if you have yeast overgrowth. This is one of my patients' GI map tests that I want to share with you guys that shows dysbiosis and a lack of good bacteria. So this patient's complaint was having diarrhea maybe 3 times a week. It wasn't too bad, too serious, but he was on the verge of, getting a diagnosis of likely IBS. You got diarrhea from his normal GI doctors. And he was also having some mood issues, having low motivation, having just feeling like he wanted to do things and get things done in his life, but just couldn't find the motivation to stick to the plan. Not ADHD or ADD patient, but questioned it. He was also having a low level of depression as well. And just in general, his energy could have been better. So we got a GI map test on him, and it showed that he was lacking a lot of these good bacteria. So in this chart, these bacteria are supposed to be present. So they're supposed to be like in this bolded range, but he was missing a lot of these keystone species, 2 of which, like Escherichia and Clostridia, they are essential to make neurotransmitters for us. So they actually make dopamine and serotonin for us. And so we were able to get this person on a probiotic that had species that have been known in studies to improve dysbiosis, and also gave him a supplement to increase his dopamine levels. And he's a changed person now and not having any more diarrhea. There was also a trigger for his diarrhea too that I didn't put on this test, but he was actually having some aversion to gluten. So we removed that, and that really helped as well. This is a different patient with dysbiosis as well, but in this case, it was too many bad bugs. So we had this this test that shows these gas-producing species, and he could have had what we call SIBO, but that's actually diagnosed through a breath test. But we were seeing signs of SIBO here. And so this is a person that had a lot of bloating and IBS-like symptoms and absorption issues. So this is a portion of the test that shows the integrity of the actual digestive lining, looking to see, what is their immune health like within the gut, and is there a gluten sensitivity issue is there leaky gut present. And so if you can imagine your gut like a water hose, it's supposed to be intact and keep the water in. With leaky gut, something has punctured the gut lining. And so all this material is not fecal material, but immunogenic molecular material is leaking out of the gut to inflame the immune system. So this can cause, leaky gut can cause a lot of autoimmune diseases and inflammation and that sort of thing. So it's really helpful to get these tests to really get an objective magnifying glass to see, you know, what's going on in the gut. And a lot of my patients that are on like a maintenance state, we get these tests about once a year just to make sure things are doing well and that they're still in balance. And so we support the gut and the microbiome by eating a healthy diet that feeds these good guys, like lots of fibers, prebiotics, resistant starches, leafy green vegetables. We make sure there's proper digestion of food. And so in today's society, you know, we have a lot of people that are on proton pump inhibitors and H2 blockers for what was thought reflux and heartburn, and they sometimes stay on these medications for a while. We're getting better at it where mainstream doctors are aware of the risks now, and they know that we can't keep these patients on it long term because it can cause a lot of bad infections and osteoporosis and that sort of thing. But that can really impair your digestion of your food because we don't have that stomach acid to kill the bad guys and to break down our protein. And it's a domino effect downstream if you are not breaking down food from the stomach level. And so we, you know, we give these patients a lot of support if we're suspective of digestive capacity issues and not having enough acid by giving things like betaine hydrochloride and bile salts and also pancreatic enzymes as well. We replace gut bacteria and treat dysbiosis. And, you know, we look to see what's low and we replace it. And if it's high, then we treat it with antimicrobials, which are not antibiotics, but they're high dose herbals like oil of oregano or berberine to treat dysbiosis. And if we need to, then we use antibiotics as well. We treat candida overgrowth, and we also treat the liver too, because we need the liver functioning well in order to help with digestion. So things that can help the liver are green tea, milk thistle, beets, vitamin A. So the general theme for the liver here is to have antioxidants for the liver. Okay, so we went over the things on the timeline here. And so I wanted to go over just some tools again to help with your sleep now. And the first bullet here is to create a new sleep habit if you're trying to reset your circadian sleep cycle. So something that I found that's helpful for my patients is if they're having trouble falling asleep and staying asleep, and their cycle is just all over the place, what's really helpful for them is to, that first night, really only go to bed when you're sleepy. And then when you wake up in the night, just get out of bed and do something that's not stimulating, like not, you know, blue light, like, you know, journal or read a book or something like that. And then when you get sleepy, go back to sleep, but get up out of bed at your prescribed sleep time. So even if you went back to sleep at 2 a.m., if your prescribed sleep time to wake up and you're planning to wake up at 6 a.m., just wake up at 6. And after about 3 days of that, it might sound counterintuitive, but it really helps reset the circadian rhythm. We talked about exercising and trying to get that exercise preferably outside with light exposure before 2 p.m. We talked about sleep hygiene, limiting TV light sources before sleep, and that slow, deep breathing to jumpstart your system into that parasympathetic rest and digest sleep state. The protein snack recommendation, if needed, is if you have blood sugar regulation issues. So to start with, having a little bit of a protein snack when you're working on getting your blood sugar balance and helping with sleep, that can really help level out your blood sugar so that it's not spiking and dropping so much. And then other things that you can consider are melatonin and magnesium supplement. What I recommend is magnesium glycinate for sleep. So, and of course, if you're having issues with digestion and stuff, melatonin and magnesium can be helpful, but definitely if your digestion is bad enough, we want to work on that concurrently. So I wanted to talk about for the next week, what I'm offering is a discount on my service that we do in our clinic called the single lab consult, where we talked about, the GI map test, the stool test in depth, but there's also organic acid tests that looks at your energy levels. It basically does the biochemical aspect and applies biochemistry to our lifestyle. So we can look to see what your sources of fatigue are, if there's presence of microbial toxins present, and also yeast overgrowth. But also the Dutch test, which we talked about, which checks cortisol and hormone levels. These are 3 tests that I do at least one of them for patients in maintenance to make sure that all the work that we've been doing, that they're able to maintain that level of health. And so, I hope this lecture was helpful for you guys in the webinar. And so if you know of, or if you yourself are dealing with chronic issues like IBS, irritable, inflammatory bowel disease, insomnia, anxiety or depression, and those issues just haven't been resolved, over the last whatever years, definitely consider getting this test in order to look, under the hood to see what's going on. And so for the next week, there is a 30% off of the single lab consult with me. That does include the lab test. It includes it, and also an 1.5-hour consult with me to interpret the lab and to also look at actionables for us to get on our way to health. And so I hope you guys can take advantage of that. To get to that link to schedule a quick call with me to see which lab test is most appropriate for you based on the issues that you're dealing with, you can go to my website, click on webinar consults at the top here, and book an appointment. If you'd like the direct link now, then definitely we can send you that now, because there are some limited spaces. And so we'll open it up to questions now. So if anyone has any questions, feel free to add to the chat, or you can unmute yourself. You should be able to unmute now to ask your questions live if you like. Let's see. And I'll go through the chat just to make sure we haven't missed anyone here. So I see a message from Megan Lime. Hopefully that's the first question on here. I don't want to miss anybody. What kind of doctor would check her liver function? Could a primary care do a blood panel, or is there a more in-depth doctor to see? So for a conventional doctor to check liver function, there's from a functional function test, there isn't a mainstream doctor that does that. When we think about liver health, we mostly rely on symptoms, but also looking at their digestion health. And so what's usually done in primary care is looking at, there's 3 blood tests that they check: AST, ALT, and ALK Phos. And that checks to see if there's inflammation in the liver. And from my experience, that's already a little bit too late to make some changes. And we can detect it a lot earlier as far as suspecting there's liver issues going on. And so after we make our interventions, we see that people's energy level is improved, their cholesterol is more optimized, because cholesterol is a really big telltale sign that something's going on with the liver. If you have a very high or a very low cholesterol, that could be a sign that there's liver issues. So a lot of times in conventional medicine, a normal cholesterol level is 200 and below. But we find that patients that are having cholesterol less than 180 actually have functional liver issues, and that they're not making enough cholesterol because of the demands on the liver. And so I guess a cholesterol test could be a sign that you can use from your primary care doctor's test, but just know that there's a little bit more investigating that can be done to see if it's the liver. And is there a more in-depth doctor to see? I would recommend personally to see a functional medicine practitioner, because most doctors, when it comes to liver health, they'll look at the numbers, AST, ALT, ALK Phos, and they'll ask if you're having liver pain, right upper quadrant pain, and if you're jaundiced, or if you have itching all the time. And if you don't have any of those things, they usually don't suspect it. Does licorice raise or lower blood pressure? It can raise blood pressure. So we want to, be selective on who we recommend licorice for. But it can be very helpful to get our adrenal gland back to balance. What are your thoughts on a gut test like Biome? I'm not familiar with Biome test. As long as the stool test shows normal commensal bacteria, pathogenic bacteria, and also gut integrity analysis by looking at immunoglobulins, by looking at anti-gliadin antigens, that sort of thing, and also looking at pancreatic enzymes, then I feel like that would be a good test. The reason why I like the GI map test compared to a different commonly used test in functional medicine like GI effects is because it's a quantitative PCR test. So it'll detect any level of presence of bacteria, good or bad. And it also has a calprotectin level 2, which is very important to look to see if you have suspicion for IBD, like Crohn's or ulcerative colitis. So I like that it's all in one test. Would I recommend this if someone has had gastric bypass? If you're talking about the GI map test, then yes, especially if they're having issues. And a lot of people with gastric bypass, they have issues. They have dumping syndrome, or they have chronic diarrhea. And so a lot of times, we can approach it without testing. I always offer that to patients because not everyone, has the means to do every single test out there. But if you've had gastric bypass, you've had, shortening and loss of a lot of your digestive capacity in the small intestines. And so a lot of times, being on digestive aids really helps. And if you're having a lot of bloating and you're having autoimmune issues, or if you're having chronic pain and you're having bloating, then I think a GI map test would really serve that person well in order to look to see what their microbiome looks like. Do you see women who are pre and postpartum? Yes, I love seeing women that are in that state because they are in the process of making another human being. And we know that the mother's health is completely tied to the child's health. And so I do see people that are pre and postpartum, and there's a lot of assessments we can do to help optimize their body in order to get their bodies ready for pregnancy. And because when you're pregnant, your liver works overtime. And I mean overtime. And a lot of people have sleep issues, especially in that first trimester. They have a lot of morning sickness, and a lot of that a lot of those symptoms are signs of liver struggle or nutritional deficiencies or a B vitamin deficiency. And so getting a comprehensive look into their gut health, their nutritional status is extremely important for that. And then postpartum is definitely huge too, because there's a lot of shifts, especially if you had interventions during pregnancy, if you had a C-section, needed a C-section, were on antibiotics, if you were diagnosed with medical conditions like liver issues or gallbladder issues while you're pregnant, we take care of those people too. And I like to see the prepartum patients early, because if there is an imbalance going on, we want to work on it before they get pregnant, because when you're pregnant, you don't want to be manipulating too many things, because that can cause stress on the mother and also potential stress on the fetus. And so we want to work on these patients early.